Hello, my name is Rebecca Sitar. I am a lactation counselor here at PAK Pediatrics at our breastfeeding center in our Clark Summit location. Today I'd like to review nipple shields, what they are, how we use them, and why we use them. So a nipple shield is a great tool that we might offer or recommend for our babies that may be having difficulty with latch. So you always want to consult with your lactation specialist or consultant before getting started in using a nipple shield. She'll be sure to size you and make sure that you and your baby have an appropriate fit. She'll guide you on application and use of the nipple shield and also how and when to wean from the nipple shield. In certain circumstances, it might be a long-term use, but in most cases, it will be used short-term, allowing our babies that are having a more difficult latch on properly. So sometimes our moms that come in that may have a flat or maybe even an inverted nipple, we may recommend a nipple shield. So I'd just like to take you through what a flat nipple looks like. So sometimes if our moms have an inverted nipple or a flat nipple, babies have difficulty because that nipple is not protruding forward, and babies tend to latch shallow or slip off really, really easy. So a shield can be a great tool in these certain circumstances. Maybe that's part of mom's natural anatomy and she may always need that shield, or maybe it's more of a temporary thing if she received IV fluids during labor and delivery and is just having some inflammation, maybe milk just came in and nipples are flat. In those cases, we would teach moms application and use and then how to wean off of the shield. So we always like to review how to apply. So I always like to recommend that moms just take their nipple shield and invert it about a half of an inch, almost as if it were like a little mini sun hat. We place it right over the nipple and part of the areola, and you can see how it protrudes that nipple forward, offering a broader surface, allowing our babies to have a deeper latch. Another reason that we might recommend or suggest that our babies or moms use a nipple shield is our babies that come in that have a tongue tie. A nipple shield, again, in these cases will allow babies to be able to have a deep latch, and moms, it'll create a little bit of a barrier if she's having sore, cracked, or bleeding in her nipples because of that tongue tie. Again, sometimes when babies are smaller in size, or maybe they're premature, they may have a low muscle tone or an uncoordinated suck. In these circumstances, while baby is adjusting and learning how to latch onto the breast, a shield may be used temporarily in aiding that baby to have a deeper latch. Again, whatever the case may be, it could be either a temporary solution or maybe more long-term. You always want to consult with a lactation specialist, make sure that you have the appropriate fit and a proper breastfeeding plan along your journey while using a nipple shield. They can be used as a great tool, and oftentimes they will help you on your journey. There are certain circumstances that they can become a barrier. So you always want to speak with your lactation consultant and she'll guide you.